Joining us now via Skype is Daniel Goldman. He's been on the show many times as a former assistant U.S. attorney for the Southern District of New York, and most recently was the Democratic counsel for the House Intelligence Committee. But this morning, he joins us in a very different role, having tested positive for coronavirus. So, Dan, I guess first question, of course, how are you feeling? How are you doing? And thank you so much for sharing with us this morning.
Well, thanks for having me on. I'm feeling a lot better. It was about 3 days of what felt like a kind of medium strength flu, a fever, a headache, cough. I think there's some mystery that the coronavirus is this plague, that if you get it, you automatically are, on a ventilator and locked down. Obviously, the concern is that with vulnerable people, that does happen. But with people sort of my age, demographic, and health, I think my experience is probably relatively typical. So I'm on the mend. I'm not quite 100%. My wife, unfortunately, now has pretty serious symptoms as well, like I had. So we're hunkered down, just weathering it out and thanking our lucky stars that our health is what it is and we can fight this thing.
So, Dan, just tell us the process and how you got tested and then diagnosed. Was that, pretty immediate? And is your wife tested, the people who are around you? How is that working?
It was very difficult and it was very frustrating. And I went public with it sort of in real time, not because I knew I had coronavirus, but because there's a lot of misperceptions out there that tests were readily available to anyone who wants them. That was simply not the case. I had symptoms. I had not been in contact with anyone that I knew to be positive for coronavirus. And that meant I could not get tested. So I got tested for the flu, which has very similar symptoms and was negative. I got a full viral panel to see if it was anything else. That was negative. And once that came back, I was told by the New York Presbyterian Hospital that I had to go home and self-quarantine because my symptoms were not bad enough to be admitted into the hospital. And unless you're admitted, you don't get a test. The crazy thing, Mika, is they sent me home, but because I had no known contact with anyone with coronavirus, they told me that I needed to self-quarantine, but that the rest of my family should go on acting as if they are normal and that anyone that I had come into contact with could continue to go around and live their lives normally. I finally just wouldn't take no for an answer, and I drove at 5 a.m. to Connecticut to get a test that came back positive. Over the weekend. So now my wife, who obviously came into contact with a known coronavirus positive, that's me, she and my 3 kids got tested this weekend, but it still takes, 2 or 3 days to get these tests back.
So you're waiting for results on your wife and your children. But Dan, back up, and then we'll move forward on how the rest of your family is going to figure this out. But you're walking around an ER getting these flu tests, or where did you get these initial tests? Because you have coronavirus, so clearly you're walking around with it in medical facilities?
I went to the emergency room and with the symptoms and already having got a negative flu test, and they put me in one room, secluded. They basically told me they could do nothing for me, no matter whether I have it or not. And then they stuck me in a hallway bed with a mask on for about 6 hours to wait for my viral panel and to wait to get a chest x-ray. I was in the hallway with people coming by. I had a mask on, but it's incredibly unsanitary and the testing situation. I don't blame the hospital. They were overloaded. Right. They're overrun with people, and they don't have the tests that they need. The medical professionals that I dealt with at the hospital were incredibly frustrated that they did not have the number of tests that they would use. They had to ration them in this way. And that is the fundamental problem here. Anything you want to hear, and that's my frustration, is that Donald Trump can keep saying that anybody who wants a test can get it. I am living proof right here that that is not the case. And that is the biggest problem we have. And the result is the laundry list of things that you just listed that need to be shut down because we don't have enough tests to actually see if people have it. So we have to take these incredibly draconian precautionary measures to keep people away from each other.
Well, and also you, of course, did your best, I'm sure, to self-isolate when you thought you might have it. But you're lying in the hallway for 6 hours because they couldn't just give you a test, and you could have found out 6 hours ago before that you had the coronavirus, and then you could have gone home and acted accordingly. But again, everybody's just sort of whistling past the graveyard. Let me ask you, so you're in New York, you can't get the test, you're in the hospital for hour after hour. You said you ended up at 5 a.m. driving up to Connecticut and getting the test. How did you get why could you get the test in Connecticut but couldn't get the test in New York?
There was a curbside clinic in Connecticut that, and it's, I think it's Greenwich Docks CT. They have a couple different locations, and my hat's off to them because they got somehow enough tests that they didn't have to ration them in the same way. So I called them on Thursday of last week. I got an appointment at 6 a.m. on Friday morning, and I went to go do it. But this was after being rebuffed repeatedly by urgent care facilities in New York, by hospitals in New York, because I didn't meet the criteria that the New York Department of Health had set, given the number of tests that they have, which is just insufficient.
We have a doctor friend who actually thought he had the coronavirus and went through the same thing as you did. It ended up that a close friend of his did test positive ultimately, but he had to go home for 5 days. It ended up he just had the regular flu, but he had to go home and self-isolate for 5 days. His entire office had to shut down. All of his workers, of course, had to go home and not work for those 5 days, all because we didn't have these tests, which, of course, as Joe Biden said last night, we could have gotten if the president had just agreed to get the tests from the World Health Organization. Let me ask you, Daniel, how do you have any idea how you picked up the coronavirus?
I traveled to London last weekend, and Friday, March 6th, I got my first symptoms the day I returned, Tuesday, March 10th. I will say this. I did not take as seriously the coronavirus as I probably should have. I probably should not have made that trip. But it felt to me like it's the flu. Everybody can get it. I'm relatively healthy. And so, when I see photos that you just showed of mass people at Disney World, I'm a person who will, explain that I didn't take it seriously enough, but everybody really needs to take this seriously. Anybody can get it anywhere. Whatever we hear about the limited number of cases, we just don't know. There's way insufficient testing to know how many people have it. There are I wouldn't say millions, but there are thousands and thousands of people walking around America right now who have coronavirus and who don't know it. And the idea that you would go and mingle with large groups of people is really silly at this point.
Yeah, well, Daniel, we're thinking about you and your wife and entire family. Our thoughts and prayers are with you, and certainly we are hoping for a speedy recovery.
Thank you
so much for being with us today.
Thanks very much. Good to see you guys again.
All right.
So let's bring in...
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.